Hello, welcome back to Polymeric Biomaterials. So far in this course, we have looked at introductory concepts followed by structure property relations in polymeric biomaterials, and we've also looked at some topics under the broad theme of temperature and solvent effects. Now, the theme for this lecture and the next few lectures is biomedical polymers, and what we will aim to do is to use the foundational concepts we have learnt in the earlier lectures, namely under structure property relations and temperature solvent effects. Use those concepts now to see how polymers are specifically used in different types of applications. And the goal here is to try to see how structure and properties help define function and performance of polymeric biomaterials as part of some selected specific applications. With that being the theme, the topic of today's lecture is synthetic biomedical polymers. We will be looking at synthetic biomedical polymers both in this lecture and in the subsequent lecture as well. So, we will begin by recapitulating some definitions that we have seen earlier for polymeric biomaterials and implants. We will then also see biomaterial classification. We will revisit that classification that we have seen earlier and take stock of where we stand in the course in terms of the different classes and classifications we have seen for polymeric biomaterials. And we will focus then on one particular mode of classification based on the origin or the source of the polymeric biomaterial, which will give us broadly two categories, synthetic and natural polymers. And here we will look at both advantages and limitations, if you will, of some of these polymer classes, and then we will move on to structure property application paradigm, where the goal is to pick 4 different clinically important applications and look at first what are the demands of that application. From a material perspective, what does the application demand, and based on the demand, how are the polymers chosen, and based on the polymer's structure, how are the properties governed, and based on the properties, what is the function of the polymer in that particular application. That is what we will be looking at as part of resorbable sutures, hip prosthesis, soft contact lenses and dental resins. And towards the end of this lecture, we will look at 2 material classes, namely polyurethanes and silicones. And remember that polyurethanes and silicones are broad names of material classes or polymer classes within which you can have a series of different type of polymers depending on what the monomer is, what the cross-linking is, etc. And what you will see here is that this is a selective exercise in some sense. Now, with any selective exercise such as this, we are going to be including certain systems or certain applications. We are going to be excluding many others. And the goal here is as follows. What we want to be able to do is to use our understanding of structure property relations and try to see how those guide function and performance in the context of these applications. So, the hope is that when you come across new applications or new polymers tomorrow, the concepts you have learnt here for the structure property application function paradigm can help you contextualize these concepts later when you come across a new polymer or new application. So, with that background in mind and those caveats in mind, we will now jump into this lecture, noting that more specific types of polymers, clinically important polymers such as PTFE or PET, will be dealt with in the subsequent lecture. So, we will first revisit our definition of biomaterials just to set the context for this and the next lecture. So, if you recall from some of our earliest lectures, namely lectures 2 and 3, where we were looking at definitions of biomaterials and biocompatibility, you will immediately recall that a biomaterial is any material that interfaces with biological systems for largely 4 things: evaluate, treat, augment or replace any tissue or organ or function in the body. And there is a material bio interface. So, there is a biomaterial with its own physical, chemical and biological interactions with a complex biological system, a host if you will. And again, recall that this is a two-way interaction. So, there is a specific biological or a clinical need for which the biomaterial is used and implanted, and whether you like it or not, the body is going to do something to the biomaterial as well, remodel it for example, and those interactions together determine what biocompatibility eventually is. If you recall some of our earlier definitions, you will be able to immediately appreciate that these interactions together, it is the system comprising these interactions which together help you define what biocompatibility is. In fact, we have even seen that there is no such thing as a biocompatible material per se. It always has to be contextualized in the context of a specific application as part of a specific system, which involves factors such as how long the material is implanted, what is the site of implantation, how long is the material intended to function, what are the mechanical forces, what is the pH involved in that region, and a host of other factors. Now, another way to think about biomaterials that we have seen earlier is that it's a non-viable material on its own used as part of a medical device. This is a very, very important idea we have seen earlier, where we have noted quite often in this course that biomaterials are seldom used on their own. They are typically used as part of a device, as part of being integrated into a device, and typically multiple materials will have to come together to achieve a specific function as part of a clinical application that is intended to interact with biological systems. So, note that the phrase non-viable material simply means that the material itself is not a living system, and so the word bio in biomaterial does not necessarily imply that the material has to be a living system. Secondly, because it's part of a medical device, it's typically used in a therapeutic or a diagnostic need. Therapy is for treatment, diagnosis is for finding out what underlying issues are. Now, if you remove both these constraints, the ambit of biomaterials opens up quite a bit. You can have high throughput assays, protein purification, cell culture, a wide variety of applications in which biomaterials can be used. Again, these are not new concepts that we are seeing. These are all concepts we have seen in far more detail in earlier lectures. I'm just helping I'm just using this to help set the context for what we will see in subsequent slides. Now, having seen the fact that biomaterials are typically used as part of a device, we will recollect our familiar example that we have seen in an earlier lecture, lecture 4, for stents. Arteries that are blocked because of plaques. There's a procedure known as balloon angioplasty through which these arteries are opened up. And we have seen this earlier. Plaque deposits, as shown here, cover the side walls of the artery, which reduces the space available for blood to flow through the artery. So, the narrowed artery has limited space through which blood can flow, and this is what eventually leads to coronary artery disease. And what we have seen is one way to get rid of this problem is to use stents, where a stent is placed around a deflated balloon such as this. It's inserted and the balloon is inflated once it is placed inside. And as it is being inflated, the plaque moves towards the walls and gets compressed. So, what you see here is the compressed plaque as shown here. Plaque simply here refers to the fat or the lipid deposits. As a result of this, the artery becomes widened again, thus restoring blood flow. This is what you would expect in a typical balloon angioplasty procedure. Now, one of the problems we have seen earlier is that with time, you can have restenosis, which is closing up of the artery again through a process called neointimal hyperplasia. Essentially, what happens is with time, there are smooth muscle cells that start proliferating, and as they proliferate, they start again thickening the artery walls, thus again reducing the space available for blood flow. Now, as a result of which, the blood flow again, having the stent doesn't really help at that point, because if you have restenosis, then you get back the old problem where you have disrupted blood flow. Now, to avoid this problem, what is typically done is people use what is called a drug-eluting stent. Now, a drug-eluting stent is a metal stent coated with a polymer with a drug that elutes over time. And what this drug will do is to actively prevent these migration and proliferation of these smooth muscle cells, which will prevent restenosis. And here we are actually mentioning specific names of polymers. You will immediately notice that it's a copolymer eluting an anti-proliferative drug, typically paclitaxel or novolimus, one of these drugs. And what happens here is, once the stent is placed inside, over weeks to months, this drug gets eluted, thus actively preventing migration and proliferation of these smooth muscle, vascular smooth muscle cells, thus preventing restenosis and thus preventing implant failure. Now, with that background being set, we will now move on to looking at biomaterial classification, and this is again to take stock of where we stand in the course with regard to our understanding of polymeric biomaterials based on how they can be classified. So, obviously polymeric biomaterials we have seen can be classified many ways, and in this course we have looked at a few different ways to think about polymeric biomaterials depending on whatever interest is. If, for example, you are interested in the composition, they can be classified as polyester or polyamide, for example, and we have looked at these concepts in these lectures. If you are interested in the architecture of polymeric biomaterials, you can classify them as linear, network, etc. And we have looked at that in that context of lecture 10. Or if you are a chemist who is interested in polymerization and the reaction schemes, then you can classify them as step growth, chain growth, ATRP, living polymerization and so on, which we have looked at in lecture 11. And note that all of these have broadly been covered under the theme of structure-property relationships. You can also classify polymers based on microstructure or crystallinity. As amorphous or semicrystalline, which was the topic of lectures 12 and 13, where we looked at this in the context of temperature and solvent effects. Now, you can also classify polymers some other ways. One of them is source. You can classify them as synthetic and natural polymers, for example, based on source, and that's going to be the topic of the current lecture and subsequent lectures as well. You can also classify polymers based on families, which we briefly alluded to at the beginning of this lecture, based on polyurethane, silicone, protein, based on what type of composition goes into them, and broadly what features are common to the structures of these polymers across different polymers within a given family. So, when you talk about silicones, for example, you can have a wide variety with that same SiO backbone, but depending on the degree of cross-linking, for example, or the molar mass or the pendant group that is attached, you can get a wide series or wide variety of polymers within that broad family called silicone. But what will remain common is that SiO backbone. So, likewise with proteins, where broadly you can think of proteins as bio-macromolecules that are connected together by covalent amide bonds. And what will remain common across proteins is the fact that they are connected by these amide or peptide bonds, and they are all made up of amino acids, but based on the type of amino acid and the ordering of the amino acids, you will get a series of different types of proteins which go by different specific names, and yet they are all broadly called proteins. So that's what we mean by family here. And this we have briefly alluded to in lecture 11, and again we will be looking at in far more detail in lectures 17, which is this lecture, and subsequent lectures as well. And note that these fall under the theme of what we are calling biomedical polymers. There is one more way it turns out that you can look at polymeric biomaterials, and that is through looking at bulk behavior and responses, which is another theme that we will look at slightly later in the course. So one way to think about bulk responses or behavior is to look at mechanisms of degradation, bulk degradation. So we have already seen that you can have polymers that degrade through ester hydrolysis, for example, or through enzymatic means. For example, if it is a naturally derived protein, proteases, which are enzymes, can degrade specific types of natural polymers which occur in the form of proteins. And that we will cover more in lecture 22, namely the degradation mechanisms. You can also classify polymers based on mechanical properties, for example, thermoplastic, elastomer, and so on. We have briefly looked at it in the context of lecture 10, and we will again revisit this in more detail in lectures 23 and 24. So, in one slide, we summarize or we give a snapshot of different ways of polymeric biomaterial classification, and we are also looking at in this course how we have covered the different classifications. So, a lot of it we have covered, some we will cover in this and subsequent lectures under these 4 different themes. So, it is very important to understand how the course builds slowly towards starting from structure property, moving all the way towards applications, function, and performance. So, with that stage being set, and being that this lecture is focused on synthetic biomedical polymers part 1, we will first start off by asking a very broad question. If you classify polymeric biomaterials by source and you have broadly synthetic and natural polymers, can we now start to ask what are the broad advantages and limitations of these different classes? So, we will first start with synthetic polymers, and broadly what I have shown in green are supposedly advantages, and what I have shown in red are supposed limitations, and what I have shown in black are in some sense they could be perceived as limitations, but depending on what your application is, etc., you can find a way to sort of work around them. So, we will quickly look through the different advantages first of synthetic polymers. Because synthetic polymers are man-made, the physicochemical properties are in some sense in your hands. You can tune them any way you want, and because you have control over the physicochemical properties, there is very low batch to batch variability typically for many of these polymers. In fact, if you can produce them at scale, then you also bring down the cost as well, and this is typically what happened around the wars. If you remember, a lot of the polymers, industrial scale polymers that have been repurposed for clinical use and still used even today, started off being produced en masse during and around the wars, because there was a huge demand for some of these high performance materials for very different applications, some examples of which we have seen earlier, and many of them have been repurposed since for clinical or biomedical applications. So, a lot of the production at scale happened because of the involvement of key industrial players in that era. What's also important to appreciate is because polymeric biomaterials are used as part of devices, it's very, very important that they can be processed into whatever desired shapes and architecture that you want them to be processed into. Typically, if you want to process them into specific shapes, processability has to be matched against performance. And we have seen earlier that as one example, we have seen earlier that if you have very high molar mass you can get very good mechanical properties, but then what happens is your ability to process them goes down because of a very large increase in viscosity. So the melt viscosity goes up significantly with very high molar mass. So while that might be desirable for good mechanical properties, your processability starts to go down. Your ability to process them starts to go down. So these have to be carefully matched for specific applications. You can also have these polymers being customized based on the nature of the patient. In some applications, for example, prosthesis, most of these polymers will have to be customized for even size and shape based on the patient needs. So synthetic polymers are very useful that way because they can be relatively easily processed without much difficulty. And as we have already looked at in some earlier lectures, many of them have been used primarily because they have very good mechanical properties and they have very good stability. Now this high stability has to be treated with a little bit of caution. When we use the word stability, what I mean here is when they are used in a clinical application in a certain location in the body, they will continue to do what they are expected to do and perform at a very high level for a fairly long period of time without a significant change in properties. That's what we mean by stability here. Now, it so happens that, again, this is not something that is new in this course. It so happens that you can also have polymers that can degrade as well, synthetic polymers that can degrade. So, those polymers that can degrade and whose properties, whose degradation properties can be engineered, can be tuned, they will not be typically considered quote unquote stable in an application. So the word stability has to be used with a bit of caution. But if your intention is that the polymer should degrade with time, for example, if you are using a polymeric vehicle in a drug controlled release application, then you want the material to degrade with time and you want to be able to control the rate of degradation, which means that in that context, perhaps we are not talking about stability from having continued a set of stable properties over time, but stability for that particular application simply means that it can release that drug over that desired time frame at a particular release rate. So, just some points to keep in mind as you encounter such words. Shown here are some limitations, if you will, of synthetic polymers. One is, for reasons that we will not get into right now, we will look at this in a more detailed lecture later, but for specific reasons, synthetic polymers, largely being hydrophobic, many of them will absorb proteins. And protein adsorption on the surface is one of the primary requisites for mounting an immune response. And in some cases, the immune response may not be favorable. You can end up getting an adverse host response, in which case the implant can get walled off in a fibrous capsule, which means it's not going to do its job, it's not going to be performing to the expected level, and that would be a problem. So you notice that while we have been continuously talking about things like mechanical properties and processability, which would be considered bulk behavior, we are equally interested in adsorption of biomolecules, which is a surface property. So you see, it's a fairly complex set of material properties that need to be looked at, often one working against another when you want to use some of these polymers in clinical applications. And very often it will so happen that no one material is suitable for a specific application, so it will be a combination of materials that's often used. And as we already said, some of these polymers can be made degradable, and the degradation can be engineered into the polymer. Now, that means that the person designing the polymer has already thought of what degradation products might come out of this polymer when it degrades, and what are the effects of those degradation products. Now, when we say unfavorable degradation products, we don't necessarily mean that they're going to be toxic to the patient. Now, those kinds of materials will not even make it to that stage, but even something like PLGA, for example, which is a polymer we have looked at quite a bit in this course, it's going to lead to degradation products that are naturally found in the body. So, lactic acid and glycolic acid. Now, these two molecules are naturally found in the body, so one would expect that they would not be considered unfavorable. And while that is largely true, notice that these are both acidic. So, a large release, rapid release of these byproducts or these degradation products through rapid degradation of PLGA can cause a significant drop in local pH, and that can have some adverse effects. And PLGA also happens to follow an autocatalytic degradation mechanism, where the more acidic it is, the faster it will degrade. So, when I say unfavorable degradation products, that's why the word unfavorable is put in quotes. This, for example, PLGA leading to lactic acid and glycolic acid resulting in a drop in pH may also be considered unfavorable depending on the application. So, it is very, very context specific. And many of these synthetic polymers are not what you would consider bioactive on their own. If you recall some of the earliest lectures we have seen, we have looked at the definitions of bioactivity and bioinertness. And most synthetic polymers are not naturally bioactive. And one example or one way to think about bioactivity is they don't have natural motifs that can be recognized by biological systems. So, they don't have ligands, for example, that can attach to receptors on cells. Those are not naturally available. So, typically such polymers, if they have to be biofunctional in the sense that they have to actively elicit a specific response from biological systems, in many cases they have to be functionalized. These two at the end, one of them is talking about the role of processing and the use of organic toxic solvents for processing of some of these polymers into the final product form, and care should be taken to avoid as much as possible the use of toxic solvents, and if they can't be avoided, then care must be taken to ensure that those traces of those solvents are not inadvertently left behind after processing before the product is finally released. So, that is why I have put it in black, because it seems like a limitation, yes, but if it is done correctly, then the system will behave itself. Now, cost is a factor, especially for medical grade polymers. High regulatory costs are involved, and this is even for natural polymers. We will see that for very high purity, the higher the purity you want for a protein, for example, the more expensive it will be. So, cost is something that we can't avoid on both sides, both for synthetic and for natural polymers. So, having looked at synthetic polymers now, we will quickly look at the natural polymers and see how they compare vis-a-vis synthetic polymers. And in a very broad and very crude sense, you will see that a lot of what is green here will become red here, and a lot of what is red here will become green here. I'm still going to go through all the points listed under natural polymers, but maybe this is one good starting point for you to think about. Natural polymers are, as the name indicates, found in nature. So, they already have motifs for, many of them have motifs for biological interactions, which makes many of them naturally bioactive, proteins for example. Many of these polymers, most of them, can be remodeled by the body through different mechanisms, which makes many of them biodegradable. For example, collagen is a polymer we have alluded to earlier, and we will look at that in far more detail in a subsequent lecture, can be remodeled by the body. So, if you are making biomaterial devices that incorporate collagen, then that has to be accounted for. The fact that it can be remodeled and it can be degraded in the body based on where it is used. Gelatin, which is another form of collagen, a processed form of collagen, can be degraded by MMPs. Gelatin is a protein derived from collagen. And if gelatin is used in a specific application and it is cross-linked, it can eventually be degraded by what are called MMPs, matrix metalloproteinases, which are simply enzymes found in the body that can cleave or degrade proteins. And there are specific MMPs that will act only on gelatin. So, if for example, you are designing a biomaterial that has or incorporates gelatin, this is something that needs to be considered, right? You can also use it to your advantage if you want to put a drug or another bioactive molecule inside, such that that bioactive molecule will be only released under the activity of MMPs. That can also be done. Now, these natural polymers, if they are provided in the purified form, they will have very minimal adverse effects because they are naturally recognized by the body. We typically don't call them biocompatible, we call them cytocompatible. Now, why we don't call them biocompatible, we have discussed quite a bit in this course, so I would encourage you to look at some of the earlier lectures. In this limited context, we would say they are cytocompatible. So, when cultured with cells, they will not cause any adverse cytotoxic effects. And of course, they are readily available from multiple sources. We have polysaccharides. In your own body, you have so many types of natural polymers available: polysaccharides, proteins, nucleotides, DNA, RNA. Then you have proteoglycans. You have glycosaminoglycans. And there's a whole host of different types of natural polymers available within our own body. And of course, you have plant-derived, sea organism-derived polymers such as cellulose, chitosan, alginate, some of which we will look at in future lectures. So, those are some of the advantages or merits. Now, you can also have some limitations. One of them is batch-to-batch variability. This is something that you can't avoid. Biopolymers, as they are called, these natural polymers, are also labile. So, you have stability issues during storage. So, they often require very controlled storage conditions. For example, they have to be refrigerated often. Some of them have to be frozen. And care has to be taken that they are not exposed to very harsh processing conditions such as changes in pH, changes in temperature. Abrupt changes will cause structural issues which will lead to problems in how they function. Unlike synthetic polymers, natural polymers typically don't do very well as far as bulk mechanical properties are concerned. And because they have many sites that can be recognized by the body and by enzymes within the body, many of them also undergo rapid degradation. There are also challenges associated with processing some of these polymers, some of which we will look at when we later on see biomaterial processing. We also have stability issues during processing, especially for proteins. If you are trying to process them, it's very important to ensure that you're not using extremely harsh processing conditions, or you find ways to stabilize them. So, for example, you will typically find that when proteins are lyophilized, there are other molecules added to stabilize the protein itself. Of course, the last two are like the ones we saw for synthetic polymers. There's always a risk of pathogens or immunogenic residues, but this is only a question of your QC, your quality control, and how you're producing it. For example, if you're producing recombinant proteins, it's only a function of how well you're purifying it, etc. Or if you're deriving from a natural source, again, how well you're getting the pure form of the molecule. Of course, for very highly pure forms, you pay a cost. I mean, you literally pay a cost. You pay a very high cost for such systems. So, with that, we should now have a very good understanding of the advantages and limitations of both synthetic and natural polymers. What we will do next is for the rest of this lecture, is to look at some specific applications and ask, how does the structure property paradigm influence the use of a specific polymer in that particular application? We will first start with resorbable sutures. And again, like I said, our goal here is to understand how structure properties guide applications. And while we may be selectively looking at maybe 4 or 5 applications for lack of time, we will be looking at concepts related to how the function is influenced by, how the function and performance are influenced by the structure property relationships that these polymeric biomaterials have. So the hope is you can use these concepts to contextualize them for other polymers that you may encounter outside of this course. So we'll first start with resorbable sutures. These are essentially surgical threads meant to degrade naturally within the body over time. Naturally, that word is very important. Once they have been sutured, what we mean here is there is no external intervention required for you to either remove them or make them undergo degradation. The idea here is they should undergo degradation naturally within the body over time, and over time also here has to be connected to what is the function that this suture is doing within that region of the body. So how long is that function required will dictate how quickly the material should degrade. So the clinical need here is non-biodegradable sutures. For example, nylon is a good example of a non-biodegradable suture. For internal wounds, typically necessitates removal after the healing is done. So if you ever had oral procedures where you've had sutures where the dentist has asked you to come back for suture removal, you will know that those are not resorbable sutures. But if you don't want that and you want a suture that can degrade naturally with time, one of the properties you want, of course, is degradation, which is to avoid retrieval through a second surgery or maybe even a quick removal by going back to the doctor. Of course, you want control over the degradation. Just because it's degradable doesn't mean it should degrade very rapidly or very slowly. It, of course, depends on the time period required for what its role is in that particular application. So that has to be tuned appropriately, the rate of degradation. And most importantly, the tensile strength should not be compromised. So oftentimes you see many of these property requirements or property demands, if you will, for many of these clinical applications will pull you in opposite directions. Because as material starts to degrade, you will take a hit in mechanical properties. But you don't want the tensile strength to be significantly compromised during the active healing process, because if the tensile strength gets compromised during that process, you can have reopening of the wound during healing, which would not be considered a good thing at all. So you have to carefully balance some of these properties when you think about designing biomaterials for this application. And one very popular choice that is used for some of these applications is polylactide co-glycolide, which is just PLGA. And we have seen earlier that it's a random copolymer which is amorphous. It has fairly high tensile strength and yet has desired flexibility, because you want the surgeon to be able to work within the oral cavity and make the knots. And PLGA, because there are ester bonds, it can undergo ester hydrolysis within the body, and the degradation can be controlled, right? So this has to be connected here. This has to be connected here. The degradation be controlled through tuning the molar mass by changing the L to G ratio. So we have seen that you can have different varieties of PLGA, PLGA 50-50, 85-15, 75-25, etc. All of which simply refer to the ratio of lactide to the glycolide groups. And the ratio determines how quickly the PLGA will degrade. Of course, the N group also determines how quickly something will degrade. And we have seen that if you have an acid versus an ester N group, the acid capped or the acid N group PLGA will degrade faster than the ester N group. So you see, there is a large amount of what you would call modularity in tuning the properties of the material, right, for a particular application. And shown here is an electron micrograph of a polyglactin 910 absorbable braided suture. This 910 simply is 90% glycolide and 10% L-lactide copolymer used intraorally for periodontal flap approximation. So, shown here is an SEM image of that. These braided sutures are also interesting because they are typically very good mechanically for the application and retain the knot strength once the knot is made, but they also give enough flexibility to the surgeon or the dentist to work quite easily. And from a tissue or a blood flow compliance perspective also, braided sutures do far better. So, here is a good example of how structure properties, which is what we have on the right here, guide function performance in the context of resorbable suture. So, here the key aspect that we are looking at is degradability while not compromising mechanical properties and flexibility. Moving on, we are next looking at the example of hip prosthesis. Now, essentially, a hip prosthesis is simply an artificial implant intended to replace damaged or diseased hip joints. For example, for patients who may have had osteoarthritis or hip fractures, where that entire part has to be replaced, then a hip prosthesis is typically used. Now, from a clinical need perspective, what you need is a femoral ball and stem implant with an acetabular cup as shown in this picture here or in this photo here. Now, you have a metal shaft that inserts into the femoral bone as shown here, and on the other side you will have, and of course this picture in this photo all the parts are shown separately. Typically it is one integrated implant. Also, this is an interesting example of an implant where a metal is combined with a ceramic and a polymer to create a device. I mean, it's a beautiful amalgamation of three very, very different materials coming together for very specific reasons to function as one integrated device. So, I'm hoping you can appreciate some of these ideas now that we have a better understanding of how materials perform. So, this shaft inserts into the femoral bone, and this part with the ceramic head and the acetabular cup will sit in the socket. So, like I say here, it's capped by a ball that articulates within the with the acetabular cup in the joint. Now, the original material that was used, if you recall the scientist here, Chanley, the initial models used PTFE based materials for the cup, and that led to a lot of erosion debris because of very poor wear resistance of PTFE. In fact, Chanley warns that long term this can have very, very significant negative impacts. A very brutal version of that we saw when we looked at the case study of the Vitek implant, which was used for the temporomandibular joint, primarily based on PTFE, that led to a lot of wear debris despite being FDA approved, and eventually it had to be recalled. So, this is something that we have seen in one of the earlier lectures. So, nevertheless, Chanley had already tested PTFE and it wasn't giving very good results. Of course, it was still better than metal on metal implants, which he was trying to avoid for various reasons, including squeaking noises, metal ion leaching into the bloodstream, etc. But PTFE obviously was not doing a very good job. The other problem that Chanley was facing was the stem of this implant was being force fitted into the femur. Thus, with repeated use, you could have loosening. So, there were two problems that Chanley was facing. So, the property requirements from a design perspective for this kind of an application include an acetabular component that has good tribological properties under articulation. So, two surfaces that repeatedly undergo articulation in close contact with each other. So, you should not have very poor wear resistance, that is not going to help. You can't also have very, very high friction coefficient, though that is also not going to help. So you want to have low friction coefficient and high wear resistance. Of course, that solves only this problem. You also wanted a solution, Chanley also wanted a solution for the loosening of the stem. And long story short, we have seen how Chanley overheard a gear salesman pitching high performance ultra high molecular weight polyethylene, and then he uses that to develop these cups which are used even today. One version of that is still used today. And we have seen in earlier lectures how the long chains and the van der Waals bonds between the long chains and the crystallinity and the entanglements within the ultra high molecular weight polyethylene lead to exceptionally good mechanical properties which you can't get with many other polymers. We're talking about 3 times 10 to the 6 kind of molecular weight here. And this obviously was shown to have better wear resistance and higher load capacity than PTFE. Now, gamma radiation, which is typically done, serves 2 purposes. It sterilizes the material and also cross-links it. So, a cross-linked version of ultra-high molecular weight polyethylene is used even today, which shows very, very good wear resistance. Now, that solved the first problem here. The second problem for which Chanley was looking for a solution came from a chemist named Dennis Smith. And he was a chemist who was working on dental resin composites. And story goes that Chanley went to him looking for a material, and he pitched acrylic resin based materials, and for holding the femoral stem in place, that eventually led to the use of polymethyl methacrylate for holding the femoral stem in place, which led to not much loosening with time. This is what you would call today bone cement. So you literally cement the stem into the femur such that the patient will not have loosening with active usage. So again, just to recapitulate, one of them shows polyethylene, the other shows PTFE. Those are the structures. So in one slide, you get a good snapshot of this idea of structure affecting properties, influencing the application, of course, through the function. So the structure properties lead to a specific functionality in the material, which is desirable in a specific application. So that's how we should think about it. We will next look at the example of soft contact lenses. Again, this is something we have looked at earlier. They are thin flexible lenses designed to conform to the shape of the eye. Now, the clinical need here is actually very interesting. The material that we saw on the previous slide, PMMA, was used as hard lenses, but because they are rigid and they cause eye irritation, and they do not allow oxygen transport to the cornea, they were not very useful. Cornea is what you would call avascular. When you come across words like this, it's good to stop for a minute and ask, what does this mean? Vascularity comes from a blood vessel network, and avascular simply means the absence of blood supply. So cornea is one of those few tissues in the body that does not have active blood supply. So it relies on external oxygen to survive. So if you have hard rigid lenses that do not permit oxygen transport, then it becomes a problem, because with time you will have what is called corneal hypoxia. At any rate, there was also, of course, there is discomfort to the person wearing these lenses also, because it causes eye irritation. It is rigid, it makes it hard to blink. I mean, lots of other issues. So the property requirements, again, from a design perspective, include transparency, of course, for clear vision. Then you want it to be dimensionally stable, such that even after placing it in the eye, such that it can maintain optical correction throughout the course of the time period over which it is placed in the eye. You want it to be soft and flexible, supple if you will in some sense, to minimize eye irritation. And of course, you want a material that can help transport oxygen across, as the avascular cornea, like I just said, relies on external oxygen for its survival. Now, when you think about properties such as these, one can immediately ask, can I use a crystalline polymer for this application? And this is a question we have asked earlier. So now would be a good time to pause and recall the implications of crystallinity from lecture 12, where I would have asked the same question. Can you use a crystalline polymer for this kind of an application? And we would have very clearly seen that that's a bad idea for the following reasons. One is, it's going to be rigid and inflexible, which is going to cause eye irritation. It's going to scatter light, which will not help with the transparency criterion that we had here. It's going to have low water absorption, which means it's not going to be soft and it's not going to be supple in some sense in the eye. And it's not going to allow oxygen to go in, which again is a bad idea because you want oxygen transport to go through the lens and reach the cornea. So given that these are the requirements, you see that the microstructure that we're talking about here is not suitable. So we have right away made a connection between microstructure and the properties for this particular application. And we've already seen that this type of microstructure will not work, which now explains why this polymer is used, namely polyhydroxyethyl methacrylate or polyHEMA. It's a loosely cross-linked polyHEMA that is used for the contact lens application. Note that the polyHEMA that is used for this kind of an application is atactic. And this is the structure of the polyHEMA that is used. So if you look at from a tacticity perspective, the fact that it's atactic and the fact that it has these large side groups, pendant groups, makes it very difficult to crystallize, which means it's largely going to be amorphous, which now helps you with the transparency criterion that you had for this kind of an application. Also note that because of the hydroxyl, it can easily stay very well in a water-based environment, which would not have been possible with a crystalline polymer as shown here. One very interesting aspect about polyHEMA is its glass transition temperature is quite high. It's much above room temperature, which means in the dry state, it is going to be behaving like a glass, which means the ease of fabrication is easily aided through milling, for example. So in the dry state, because the glass transition temperature is significantly higher than room temperature, the material behaves like a glass and the processability is enhanced. But once it is put in the particular site in the eye, water enters, and water is what you would call a plasticizer. In some sense, it's a universal plasticizer, and plasticizer is a word we have encountered in a lecture that we have looked at on the amorphous nature of polymers, lecture 13, where we have seen that it's any small molecule that can get in between voids, etc., and free up, increase the free volume, disrupt the interchain interactions, increase the free volume, and thus lower the TG. So once water absorbs, because of the hydrophilicity of the polymer, water gets absorbed, and once water gets absorbed, the TG significantly drops to the point where this now starts to become very soft and supple, thus meeting the criterion of being soft and flexible. And it's not a magical polymer, so it can't check all the boxes. It checks most boxes, and the oxygen permeability criterion is often met by copolymerization with fluorinated methacrylates. On its own, polyHEMA does not allow great oxygen transfer, but that can typically be overcome by copolymerization with fluorinated methacrylates, which increases the oxygen solubility in the lens. And shown here is an example of a polyhema based hydrogel contact lens loaded with a surrogate fluorescence dye. Next, we will be looking at organic, inorganic dental composites. Now, the idea here is, again, we are looking at how structure properties guide applications, but now in the context of dental resins. So, these restorative dental composites are essentially tooth-colored synthetic resins, essentially highly cross-linked networks to repair and restore teeth. One common example of that is a cavity filling. Now, the property requirements for this kind of an application are very unique and can broadly be classified into physical, mechanical and biological properties. Now, from a physical perspective, you want to have the correct kind of rheological properties, the correct kind of flowability and workability as the dentist works with the material. It also has to cure or cross-link within a reasonable amount of time, and you can also think about the cross-linking efficiency there. And it should also not have significant shrinkage stress. So, shrinkage stress happens because when these liquid-like solutions cross-link and form a resin-like network, there is a contraction that happens, volume contraction that happens. And because they are in close contact with the teeth and enamel, etc., they are constrained in that volume. So, they transfer that stress to the other side, and thus the interface between the resin and the tooth is subject to a lot of stress. And over time, that stress can lead to debonding, or it can lead to small holes through which liquid can flow through, food particles can get lodged, bacteria can get in, and the part can get infected. So, these are things that have to be taken care of very carefully. From a mechanical perspective, you want, of course, strength and fracture toughness, but because it's used in dental restorative applications, you also wanted to have very good wear resistance. And of course, from a biological perspective, you wanted to have antibacterial effects so that the site of application doesn't get infected. And of course, you wanted to integrate with dentin. Now, it's very difficult to find one material that will suit all of these or check all of these boxes. So, what people have come up with is what you would call a bottom-up approach to biomaterial design. So, you mix components together such that every component brings in its own unique property, and together the integrated device, if you will have all the properties that you want for this application. So, we will look at 4 or 5 such important components of these resins. The first one is what you would call the base monomer, which is bis-GMA. This MA simply stands for methacrylate. Now, if you recall polymer structure from the earlier lectures, you will immediately be able to connect this with the ability of the methacrylate group to cross-link in the presence of light of a specific wavelength, right? So, it can form a cross-link network. So, it's a bifunctional methacrylate which can form a cross-link network, very high molar mass, very high viscosity, very good mechanical properties. But the limitation is that because it has very high viscosity, typically when fillers are added, they don't distribute uniformly throughout the matrix, and the high viscosity also makes it hard to work with the material. So, typically what is done is a diluent monomer is added. In this case, it's TEC-DMA. Again, there is a methacrylate here. And what this does is, because it's a low molar mass monomer and has a flexible backbone, it balances out the workability and the rheological properties, the viscosity and the curing time, such that you get a good sweet spot in between where you can still work with it while still not compromising the mechanical properties significantly, which largely come from the bis-GMA. You also have something called an adhesion promoter, in this case this 4-meta, where the M stands again for methacrylate and A stands for anhydride. And in this context, you have an organic-inorganic component. So the organic component is the polymer itself, which cross-links, and the inorganic component is the hydroxyapatite or the calcium phosphate, which is found in the teeth. So we have these adhesion promoters which are bifunctional, where one end can, which is the methacrylate functionality, allows polymerization with the rest of the composite, while the other side, anhydride, can favorably interact and bond with the dentin or the calcium phosphate or the hydroxyapatite found in the teeth. So that acts as an adhesion between the composite resin and the dentin or the enamel. Typically, inorganic fillers are also added, which enhances the mechanical properties of the overall resin. Typically, silica or quartz, these kinds of fillers are added. Sometimes zirconia, alumina, these kinds of particles, ceramic particles are added. And to serve the antibiotic functionality, quaternary ammonium is also added. And these are mixed together and cured and set in situ. As shown in an example here, where the picture A shows the cavities prior to application, and what you see here is right after finishing and polishing, and this is after 1 year of follow-up, and you see almost no changes there. These are commercially available restoratives, given the names are given here, used for cavities on permanent human molars. So what we get to understand here is two things. One is, we have been able to connect the concepts we have seen in lecture 10 on networks and thermosets to how those can directly be used for a dental resin composite application here. And the second thing is this idea of a bottom-up approach to biomaterials design, which is when you have multiple properties that are required, and when no single material can satisfy all those properties, then sometimes this approach is quite useful, where you combine a group of materials. Of course, there are lots of factors to take into account, which is, are the materials compatible with each other? For example, are the inorganic fillers, are they homogeneously distributed, or do you have a specific concentration of fillers in certain regions? Is all of the the monomer cured? All these factors have to be taken care of. But with those caveats, one can still come up with a good composite where that integrates multiple types of materials with different functionalities, each with their own unique features that together give you the combination of properties that you want for this particular application. Now, with this, what we have seen so far is how structure properties guide applications. And towards the last part of this lecture, we will now be looking at two material classes that are very, very important in biomedical or clinical applications, namely polyurethanes and silicones. We will begin with polyurethanes first. So, this is again something we have looked at in earlier lectures briefly. These are essentially segmented block copolymers with alternating hard and soft units. The hard units are essentially diisocyanates and the soft units are polyol, which could either be polyether or polyester. Now, they are a class because you get a large or a high degree of versatility depending on what the R and the R prime groups are. You can get quite a bit of variety in the functionality, thus giving you polyurethanes with very, very different properties. And we have seen in polyurethane synthesis that this is a poly addition or a step growth without condensation kind of a reaction scheme. So, what's interesting about these segmented polyurethanes is the unique microphase separated morphology, where the hard and the soft segments form different rich and lean phases, giving rise to this unique microphase separated morphology. And in terms of the temperature vis-a-vis the mechanical properties, the hard segment typically is glassy or crystalline at the use temperature, which typically contributes to strength and toughness. And the soft segment, namely the polyether or the polyester diol, typically exists above its TG and is thus rubbery at the use temperature, which provides flexibility and elasticity. So, that's a unique combination of properties that some of these polyurethanes, segmented polyurethanes can have. And some examples of diisocyanates are provided here. If you want biostable polyurethanes, meaning polyurethanes that will last for a very long time, typically TDI, toluene diisocyanate is used. So, toluene diisocyanate. So, the name should be very clear. You should be able to draw the structure given the name of the polymer simply by looking at the functionality. And likewise, diisocyanato-butane, where again diisocyanato-butane, 4 carbons. And BDI is a bioresorbable polyurethane, meaning if you want to use the polyurethane for tissue engineering or drug delivery applications, you might want to prefer BDI, whereas if you want to use it as a insulator lining, for example, or more applications where life expectancy is expected to be high, then you use something like TDI. Although one must mention that where you have degradable polyesters with aromatic diisocyanates, then there is a cause for concern for toxicity that should be kept in mind. And the other component in the polyurethane, of course, is the polyol segments, which typically are polyesters or polyethers. So, you can have a polyester diol or a polyether diol, and the polyether is more resistant to degradation than polyesters. Again, you get degradation from, for example, if you have esters, you can have degradation that they can undergo through hydrolysis. So, there also you can engineer and tune the degradation rates. This gives polyurethane some very unique properties overall. Namely, one specific type of polyurethanes are these thermoplastic elastomers, which are called thermoplastic polyurethanes, which include both the thermoplastic processing ability of materials without compromising the elastomeric properties, which is very, very unique to TPUs. So, this combination of elastomeric properties, rubber-like properties, along with the thermoplastic processability gives very unique, confers very unique properties on TPUs. So, if strain is applied, the soft segments deform and elongate, while the hard segments stabilize and ensure recovery upon strain removal. So, this is again very, very unique to polyurethanes. The thermoplastic, so this is the elastomeric property, and the thermoplastic processing ability comes because you have physical crosslinks between the hard segments, which can be undermined by heat, and upon cooling they can be reformed, right? So, this is something we have seen is a property of thermoplastics, which can be heated and cooled and reformed. And note that this is not possible with permanently cross-linked networks, which if you heat them, they will simply decompose or degrade. You cannot break the bonds. Here the cross-links are physical, which means you can break them and reform them. So, this gives you the thermoplastic processing ability. And one very common application of polyurethanes is their use as electrically insulation in electrically conductive lead wires for cardiac pacemakers. So, PU insulation along with silicones are very commonly used as insulating materials for the conductive lead titanium or platinum wires that are used in cardiac pacemakers, which we have seen in lecture 4 are essentially artificial pacemakers implanted in patients for whom the normal sinus node has started to behave erratically, which means the electrical impulses are not supplied properly. So, the artificial pacemaker takes over its job and helps the heart fire electrical impulses correctly. So, shown here is a photo of an implantable cardiac pacemaker, where the wire is surrounded with an insulation which is largely polyurethane plus silicone. And compared to PDMS, for example, which is polydimethyl siloxane, this polyurethane has superior tensile properties and better tear resistance, which means you can come up with very thin insulations without compromising handling and mechanical properties. So when you try to do one, you shouldn't be compromising the other. And as you will always notice, but when you have a combination of such properties that are required, you will see that when you are able to improve one set of properties, the other will start going down. So there is a sweet spot that often biomedical engineers have to find when designing such materials. These materials also show very high flexibility and thermal resistance. And the polyurethane surface has lower friction when in contact with blood and tissue compared to PDMS, which makes it easier to insert the leads. One limitation, of course, is that these can undergo metal-induced oxidation, leading to degradation, and it can also undergo environmental stress cracking, typically with very long implantation periods. So that's polyurethanes. The last material class we will look at before we end this lecture is silicones. Silicones are very different from all the other polymers we have seen because they don't have an organic backbone, they are inorganic. They don't have a hydrocarbon backbone, rather they have a silicon-oxygen backbone. So they have an alternating inorganic silicon-oxygen backbone with pendant organic groups. And depending on what the organic groups are, the properties of silicones can vary widely. Silicones also have some very unique properties because of the bond polarity of SiO and ionic nature arising from the low electronegativity of Si, which leads to exceptionally high stability of silicones in many applications. They also have very strong bonding as a result of that, which results in very high stability of silicones and that is desirable in many applications. Because of a very small rotation energy associated, they have very highly flexible chains. And what's fascinating is the category of silicones can exist as fluids, as emulsions, as resins, and can be formulated into elastomers, gels, and adhesives. Now, what explains this wide variety of properties? They can be changed based on a couple of factors. One is, of course, the molar mass. The second is, of course, the cross-linking, degree of cross-linking, for example. And the third is what type of pendant groups stick out. So these pendant organic groups I was talking about, what kind of groups are those? So when you have flexibility in all of these things, you can achieve a wide variety of properties going from fluids to resins to elastomers to gels to adhesives. That's the variety you have. So shown here is a generic structure of a siloxane. One version of that, one specific version of this, that is polydimethyl siloxane or PDMS, which is this dimethyl group sticking out from the silicon. Now we will look at PDMS in slightly more detail because that has some important biomedical applications. The methyl groups that stick out from the silicon shield the SiO intermolecular interactions, as a result of which PDMS has some very unique properties. One very important characteristic of PDMS is a very low Tg value, which means it's going to have very high free volume at body temperature, which also explains why it is elastomeric and rubber-like. And because of the high free volume, you have very high solubility and diffusion coefficient of gases. For example, oxygen or water vapor that can easily go in. And as a result of which, like I just said, cured silicones or cross-linked silicones are elastomeric at body temperatures without the use of plasticizers, and that largely has to be tied to a very low Tg value. Another downside, if you will, of having these methyl groups sticking out is you can make these very hydrophobic films out of these PDMS kind of materials, and for reasons that we will look at in more detail in a subsequent lecture, they can very easily get coated with proteins when interfaced with blood and tissue, which can possibly lead to scar tissue capsule during wound healing. In fact, this is a problem for breast tissue augmentation or reconstruction, where with time you can have a condition where the region surrounding the silicone becomes very hard and rigid, thus giving a lot of pain and a lot of inflexibility to the patient. And silicone elastomers, we will simply look at elastomers and gels as two representative classes from the broad category of silicones. Elastomers are essentially 3D networks that are formed via covalent cross-linking, and the cross-linking that occurs is called curing, where a cross-linked network is formed, and these are covalent cross-links, remember, so they can't be broken through heating. And elastomers, when silicones are present in the elastomer form, they typically incorporate a filler which reinforces the matrix, giving it better mechanical properties, reduces the tackiness as well, or the stickiness. And typically these are provided as a two-part kit, which are mixed at use in situ. Part A typically contains the polymer and catalyst, and part B contains the polymer and cross-linker. And like PMMA, for example, this is also mixed in situ at the site as required. And once it is mixed, it is allowed to cross-link and cure over time, and then it forms this nice elastomeric network. And like I just said, once it is cured, the elastomer, because of the covalent crosslinks that are formed, cannot be reprocessed. They are set. And this has to be connected to polymer architecture. That we have seen much more detail as part of lecture 10. The other type of material you can have in silicones is gels. These are fairly lightly cross-linked networks, and one can think of them as between the fluids and the elastomers. If you think of it in terms of mechanical properties, you have fluids on one side, silicone oil for example, and you have silicone elastomers on the other side. These gels will be somewhere in between. They don't have fillers, and they're very lightly cross-linked. And once typically PDMS, for example, network is taken and is swollen in the presence of silicone fluids, that's what gives rise to this gel. And the consistency during the curing can be controlled by the degree of cross-linking, like I've already said, and the type and quantity of what silicone fluid is being used to swell the material. And silicones are ubiquitous in biomedical and clinical applications. They are used in extracorporeal equipment. So many of the tubing or membranes in kidney dialysis and blood oxygenators, silicones are used because of blood compatibility and gas permeability. Now you see again we are connecting TG to structure, to TG, to higher free volume, to ability to promote gas transport to an application. So it's a beautiful set of connections that we can make when we look at something like silicone. They're also used in catheters, drains and shunts. One example is a Holter valve, which is just a shunt where there is excess cerebrospinal fluid built up in the brain, leading to pressure. And to decrease the pressure, a shunt is placed, and the silicone elastomer and tubing, this silastic tubing, is used to drain the excess fluid from the brain downwards until the pressure gets equalized, and that is a problem can be fatal for patients who suffer from it. Of course, as we have seen from the beginning, silicones can be used in reconstructive surgery for chin, nose, cheek, calves, etc. And of course, for breast prosthesis, it's quite often used as opposed to the 60s where silicone gel was simply being injected. Nowadays, we have an elastomeric shell within which silicone gel exists. And those can also be processed based on the patient needs. So with that, we come to the end of this lecture, and as we close, what I would like you to keep in mind is this idea of how processing affects structure, structure affects properties, properties affect function, and function directly impacts performance in specific applications. So with that, we will close this lecture, and in the next lecture, we will take up specific types of synthetic polymers and look at again how structure properties determine function and performance.